मेरा नाम मोहम्मद अयूब है। मैं टोली चौकी सब्ज़ा कॉलोनी में रहता हूँ। बहुत मेरे को सांस लेने प्रॉब्लम होती थी, सोने नहीं आता था रात में। मैं बिल्कुल एक एबनॉर्मल लाइफ जी रहा था। अब उसके बाद अब 2024 में फिर मेरे को एक सडन प्रॉब्लम आई, जिससे मैं कोलैप्स हो गया, हॉस्पिटलाइज हुआ। पहले उस तरफ तो फिर सुधीर नाइक सर बोले ये आपको अब पीसमेकर डलाना ज़रूरी है। अब उनसे फिर मैं डॉक्टर सोमन देवीदत्ता से मिला। बहुत ही नेक दिल इंसान है, बहुत अच्छे हैं। फिर वो मेरे को सजेस्ट करे कि भाई आप पीसमेकर डला लें आप, तो आपकी लाइफ बेहतर हो जाएगी। तो मैं उनके कहने से फिर राज़ी हुआ उनके उस पर। फिर वो मेरा जैसा पूरा प्रोसेस कंप्लीट किए, वो ईएफ डाले, पीसमेकर डाले। बहुत ज़बरदस्त है, जिसे अपने एक भाई से बढ़ के है डॉक्टर साहब, डॉक्टर सोमन देवी दत्ता। इतना केयर करते हुए मैं कोई डॉक्टर को नहीं देखा आज तक अपने। इसलिए मैं उनका तहे दिल से शुक्रगुजार हूँ कि वो मेरे लिए जो भी किए उसके लिए। एक अपना समझ के जो करना, अपना समझ के जो बात करना, ये बहुत बड़ी बात है। फिर उसके बाद यहाँ अपोलो हॉस्पिटल में भी मेरा 18 मार्च को पीसमेकर डाले। माशाल्लाह से पूरा स्टाफ भी बहुत अच्छा था, पूरे हर चीज़ अपडेट। आप बोल सकते हैं हैदराबाद का सबसे बड़ा हॉस्पिटल नाम है, तो फिर काम भी वैसे ही है इनका। थैंक यू वेरी मच।
Hello everyone, greetings. I am Dr. Soumen from Apollo Hospitals, Hyderabad. I'm a cardiac electrophysiologist. It gives me immense pleasure and a sense of pride to talk about Ayoob Khan, who was so sick. Retrospectively, looks like a fairy tale for him. He came to us about 3 months back and he was suffering with this condition called dilated cardiomyopathy, which is quite common these days. And he had been suffering with this problem with a very progressive course for the last 7-8 years. Unfortunately for him, he missed out on a couple of good windows where a surgical intervention could have been done to correct his course, but he failed to grab those opportunities. And about in the month of March, he came to us with almost end-stage cardiomyopathy, where his heart failure was so progressive and so almost advanced that he could hardly walk in his room. He needed help to go to the washroom. He could not sleep flat because just lying down would make him breathless. In a way, his life was so badly crippled that he was almost, in a way, waiting for the eventual outcome to happen. He was with Dr. Sudhir Naik, a very eminent senior cardiologist of Apollo, for a while, and he had been also suggesting him about a procedure which would have corrected. And after a thorough counselling with me, despite his advanced symptoms, we discussed about the pros and cons, and there was still a potential benefit with the intervention that we did eventually, and he was ready. So this procedure is called Cardiac Resynchronization Therapy, and we married it along with another intervention called physiological pacing, which is essentially the two most advanced technologies for select patients with heart failure as far as pacing is concerned. And that was done. So we did a CRT with conduction system pacing, and surprisingly we got phenomenally great results in the cath lab. And I was to an extent surprised with his recovery, which was evident within 48 hours. The same man who came to us during the admission for the procedure could not lie down, and I had to take a step back. I was actually worried about the procedure, whether he could be able to take it. But we waited for a while, we stabilized him for a couple of days, and eventually the procedure was done with good success, like I said. And after the procedure, his recovery has been beyond expectation, and he almost became completely mobile, independent within the next 1 week. So much so that I'm proud to say that he had a long dream of visiting Kashmir and Ladakh, and far from doing the trip, he couldn't walk a couple of steps. And I'm so proud to say that he just completed a long trip of Kashmir and Ladakh, where he went to those high altitude and adverse terrains, completed a 15-day trip. He sent me photos, and now he's back. He's completely independent. He has a wonderful sleep. His appetite is back, and he looks quite upward in his health, and looks like his recovery is well on course. And I thank God for being on our side. I really thank Ayoob for this opportunity, and really feels grateful to have such kind of results where we can really touch patients' life and alter their outcomes. The family is very grateful, and I'm actually equally grateful for them for the opportunity. And I wish them, him and his family, all the very best and a bright health for future as well. Thank you so much.